Hi, my name is Melissa Cannon, and I'm here today representing California Food Policy Advocates. I'm joined by a number of our coalition partners to ask you to invest in serving healthy meals to low-income children in childcare. We know that in order for our children to grow, they need food. They need food to develop. Unfortunately, for many young families who are struggling, they're struggling to afford their basic needs. At the same time, limited resources make it difficult for family child care providers to meet the nutritional needs of the children in their care, and California can help. We're requesting funding to reimburse family child care providers and child care centers at the same rate that the state currently provides funding for schools to supplement the cost of serving healthy meals to children. For decades, California took this approach of supplementing the cost of serving healthy meals to low-income children in childcare, but in 2012, at the height of the recession, that funding was cut and thousands of children lost access to healthy meals since that cut was made. Today, our state's financial outlook is in a much better place, and it's time to bring back what we know works. With this funding, the state can help young children access an extra snack every day, or make sure that children have a dinner at least once a week if their parents are working late. For just a small amount of funding, we can go a long way to also help family child care providers who are cutting into their own limited budgets to serve the children in their care. Thanks.
Thank you.
Hello, my name is Berta Segura, and I'm here to represent Family Resource Referral in San Joaquin County. We serve about 941 licensed child care providers throughout the state, and also including 351 here in Sacramento area. Unfortunately, our providers were not able to attend today to this hearing because they're the sole operators of their business and have to attend to the kids. If they could attend, they would tell you that they want to serve healthy meals, but limited resources and high costs make it difficult for them to meet their nutritional needs of the children in their care. Many of our providers are low-income themselves. About 20% rely on the SNAP program to feed themselves and their families. The same providers are often cut their family food budgets to feed the children in the care because they know some of the children, the only solid meal that they would receive in their care. Since the state cut fundings back in 2012, many of the providers were forced to drop the food program because they simply could not afford it. Majority are low incomes in rural areas. Reimbursing the child care providers for serving healthy meals will go a long way, both providing food to young kids, but also supporting the viability of the child care workforce. Thank you.
Good morning, I'm Christine Smith. I'm the Senior Director of Nutrition Services for Neighborhood House Association in San Diego. I'm a registered dietitian and also an advisory committee member of the Child and Adult Care Food Program Roundtable. And I work for Neighborhood House Association, which serves 6,000 Head Start and early Head Start children in San Diego County. My department, Nutrition Services, delivers and prepares 1 million meals every year. In 2012, as you've heard, the state funding for meal reimbursements was cut. As a result, my agency lost $60,000 in just 1 year. We've scrambled to raise money by fundraising and writing grants, but that's not guaranteed money, as you know. The state requires us to serve healthy meals. We follow the Child and Adult Care Food Program. The meal pattern has changed this year. In October of 2017, since then we've been required to serve even healthier ingredients to our children. But the cost or the reimbursement rate did not keep pace with that, and that is why we need the 23 cents per meal to be reinstated. Thank you.
Thank you.
Good morning. My name is Ken Hecht, and I'm the Policy Director at the University of California's Nutrition Policy Institute. NPI engages in research to strengthen policy. Our focus is on the federal food programs, like the Child and Adult Care Food Program, which serve younger children. State and national surveys show that most Americans consume far fewer fruits and vegetables than the dietary guidelines say they should. This is particularly harmful at the young ages when children are growing rapidly, when their brains are developing, and when they are forming taste preferences and dietary habits that will last a lifetime. Unfortunately, fruit and vegetables are relatively expensive foods. For the nearly 1/4 of California's young children who live in poverty, these are likely to be missing from the family diet. The federal Child and Adult Care Food Program helps make up this deficiency, but particularly in a state like California, the federal reimbursement does not go far enough. With the 23 cents per meal being requested in this item, a child care center could serve carrots, apples, oranges, all grown in California, so the farmers will be happy, and make a child that much healthier. With so many young children facing poverty, we need to act early to set our youngest learners up for a lifetime of better health and success. Thanks a lot.
You guys sure?
Absolutely.
Mr. Chairman and members, Brendan Tuig on behalf of Kedango. We're a large provider serving over 4,000 children in the San Francisco Bay Area. And then 95% of the children we serve receive subsidized care. And we know, others have mentioned it, that providing healthy meals, nutritious meals to children can make a difference both physically and academically. And so we see better outcomes because of that. And we meet the standards, and we get some funding from the Child and Adult Care Food Program at the national level. But even with that, we struggle to make it work because Kedango operates in the Bay Area, which is a high-cost region. We are fortunate enough to have our own kitchen. That's one of the ways we make it work. But you have to remember, we're only reimbursed at the federal level $1.75 for breakfast, $3.23 for lunch. And so, to make all that work, that goes into food preparation. It also goes into our facilities costs, travel costs related to getting the food around to the different locations and getting the food there in the first place. And so, we struggle to make it work, and we know that we could do more and do right and be making a better investment in our children by providing this funding to our youngest learners. Thank you.
Hi, Laura Magnus, daughter 4C, Sonoma. I wanted to urge you to consider reinstating the state meal. My agency, we run the food program in 3 different counties at a significant loss because we want to make sure that providers and children in those counties have access to this program and nutritional meals. Thank you.
Thank you.
Good morning, Keisha Nguyen with the California Child Care Resource and Referral Network. We are also in strong support, as many of our members have preceded me, of the food program, CACFP. Since the California eliminated the supplemental reimbursement, we saw a significant drop-off in participation in that program. And in many cases, that means that child care providers no longer provide food in their programs because they themselves are food insecure. So we strongly support full bellies.
Good morning, Nina Boothie, California Child Development Administrators Association. Additionally, we would like to reinstate the California supplement for the Child and Adult Food Program. Again, this was eliminated as part of the Great Recession in 2012. So we really see these as helping to make our system robust.
Dion Arender on behalf of the State Council of SEIU and also United, the AFSCME, United Domestic Workers Act. We also want to let you know that we're in support of the food policy advocates, the request in regards to increasing the daily rate for meals particularly for our family child care providers, who you heard of, many of them have left the program because they can't afford it.
Thank you. That wraps it up. I just want to tell everybody thank you for your participation. We hear you loud and clear that these issues have been a priority for the Assembly and the Subcommittee, and they will be again. We know we need to invest in our human capital for our kids and our families throughout California, and we need to save for a rainy day, but as we heard earlier, for so many it's raining and pouring all across California for literally thousands of families and youngsters, and so we'll keep this in mind when we take our final action in a few months. Thank you.